All right, I think we can start. Good morning, good afternoon, good evening, everyone, wherever you are on Earth. Thank you so much for being here today with us. This webinar is co-organized by the Space for Climate Observatory and the UN Office for Outer Space Affairs. This is the third ClimateSCOpe that we organize. This is a series of webinars that aim to present the portfolio of projects of the Space for Climate Observatory and raise awareness globally about the use of space applications for climate change. So for those who do not know about the Space for Climate Observatory yet, it is an international initiative bringing together 61 public and private entities in Earth observation across 51 countries. Its mission is to coordinate global efforts to enhance the use of satellite data and digital technologies for climate action. The scope focuses on developing operational tools for climate monitoring, mitigation, and adaptation to support decision makers and the public. The portfolio of the projects now includes 122 projects with various scopes and objectives. And such webinar of today is about explaining what is the scope about, what are the project about, and presenting the scope project. Today's webinars is dedicated specifically to the nexus between space and health and how this ultimately contributes to addressing climate challenges. We will hear about 3 scope projects. So they have developed online monitoring and early warning system to reduce health risks from air pollution exacerbated by abnormal weather conditions, predictive mapping tool designed to help health authorities target areas at risk of Aedes mosquitoes proliferation for effective vector control and prevention of arbovirus diseases. And they have integrated satellite-based climate and environmental data into Earth surveillance systems to develop early warning tools for disease control. And to start our webinar, we will now hear what I believe will be a very insightful presentation from the Geneva Digital Health Hub, who is working on the elaboration of space-based essential variables and on what Earth observation adds to public health risk assessment. So to start, I will now leave the floor to Caroline Perrin-Franck, who is the Executive Director of the Geneva Digital Health Hub, and Stefano Ferretti from the European Space Agency. Caroline, the floor is yours. Thank you.
Thank you. I'm just waiting. Yeah, perfect. You have the slides up. Thank you so much. Thank you for the invitation. Hello, everyone. My name is Caroline Perrin. I'm from the Geneva Digital Health Hub, and I will be speaking together with Dr. Stefano Ferretti today on the concept of and the vision of the space-based essential health variables and how we plan to build them from real user needs. Next slide. Perfect. So before I go into details, a little short notice on, sorry, the slide before, but yeah, why we're speaking about this. So at the Geneva Digital Health Hub, we host the Space and Global Health Network, which is a network that's coming out of the UN Interorganizational Working Group and is also linked to the Space and Global Health agenda that's discussed under COPOS. And the idea of the Space and Global Health Network is really to align forces between all the different initiatives that already exist, help coordinate and connect. Next slide, please. So the Space and Global Health Network is really part of a larger effort and activities in the sector. The point here is, even so we are part of the Geneva Digital Health Hub and the University of Geneva, this is not just an academic idea. We're really trying to respond to real international coordination need. And that coordination need becomes very concrete when we look at the kinds of health and climate questions public health actors are dealing with right now. Next slide, please. when we say Earth observation for health and climate, we're really talking about how climate-driven environmental change can reshape health risks and how satellites can help us see those changes early and consistently. Health impacts don't only come from climate in the abstract. So when we speak about the climate change, they really come through pathways like water systems, health exposure, vector habitats, and ecosystem change. And public health teams are then asked practical questions like, where's risk increasing? When should we act? And how do we prioritize our limited resources? Earth observation is useful because it can give a shared, repeatable view of the environmental conditions that often sit upstream of health outcomes. But let me make this a little bit more concrete with 2 examples. So please, next slide. First, the first example is about the algae blooms. So consider harmful algae blooms in the Baltic Sea, water temperatures changing, changing rainfall and nutrition runoff can contribute to more frequent or intense blooms. And that matters for health because blooms can affect water quality, recreational exposure, sometimes drinking water sources, and broader ecosystem. Now, from a public health or environmental authority perspective, the operational need isn't tell me climate change is happening. It's really to understand where are blooms developing now, how extensive are they, are conditions worsening compared to last week or last year. And the exact example to make this a bit more concrete is mosquito-borne risks like West Nile. As temperatures and seasonal patterns change, the geography and seasonality of vectors can shift, meaning areas that historically had a very low risk across Europe are now seeing higher risks. And for health authority, the question becomes very practical. So where are environmental conditions becoming more suitable for mosquitoes? When does the season start earlier or last longer? Where should we intensify surveillance or prevention messaging? So these examples show the pattern. Health needs are asking for actionable, comparable signals. So what does Earth observation add in a systematic way? Next slide, please. In both cases of the examples we just saw, Earth observation contributes to upstream risk intelligence. It adds coverage where ground monitoring is uneven and a consistency so different regions can compare signals using the same definitions. It also adds timeliness because many satellite products update frequently, which matters for early warning. But here's the key. Earth observation becomes most powerful when it's integrated into a decision workflow, linking environmental signals to what someone will do differently. And because there are many possible Earth observation indicators, we need a coordination approach to decide which ones to prioritize. Next slide, please. And here, I think a good example is to point out to the Sustainable Development Goals, because climate-sensitive health risks affect outcomes broadly. And the SDGs are also a good analogy. They started from real needs. And we want the same discipline for space-based essential health variables. Define them from user needs first and then build on what Earth observation can deliver reliably. Next slide, please. And I would also like to draw the attention to another example. In climate science, the essential climate variables approach helped the community to converge on a core set of measurements that are scientifically credible and operationally sustained. Essential climate variables show how the climate community agreed to a core set of variables and then produced long-term, consistent satellite datasets at scales. And through initiatives like ESA's Climate Change Initiative, we are borrowing that proven logic for health risk assessment with space-based essential variables for health. Next slide, please. We want to explore an analogous concept for health risk assessment, a minimum set of Earth observation derived variables that are especially important for public health decisions in a changing climate. This is not about, creating the perfect list on day one. It's about building a shared foundation. So we stop reinventing indicators in parallel, and we make products interoperable and usable across institutions and across sectors. So what is exactly the vision? What are we trying to achieve with the space-based essential variables for health? Next slide, please. Our vision is really a set of routinely produced, well-documented variables that health actors can actually use. And success for that would mean it's a set of credible, repeatable, and indicators that are connected to decisions. And if we want that vision to work across countries and institutions, interoperability really becomes central. Next slide, please. The reason why we need to agree on a core set is the interoperability. It's not only space agencies aligning products, it's also ensuring outputs can be combined responsibly with health data and decision workflows. So interoperability is really what makes Earth observation usable at scale, same definitions, same methods, metadata, and uncertainty, so products are comparable and can be integrated with public health data. And I understand that this at the moment is still a vision, a concept, but we are really working on operationalizing this. And we are going to start in the process of the Space and Global Health Network and in the work plan of the Health and Global Space and Global Health Network, the process of first finding a consensus on what variables should be measured, and then the next steps after will be operationalizing them. While this sounds still a little bit abstract, it's something that is kind of already in use today. So now it's my pleasure to hand over to Stefano Ferretti, who will show 3 concrete examples of ESA where Earth observation signals already exist and can be operationalized. So I think he will speak about the green environment, water, and heat.
Caroline, I think Stefano is not with us at the moment. I don't see Stefano connected.
Okay. You can move the slides, and I can try to jump in. Yes, so I think here it's also really about the core concept of the space-based essential variables of health, that if we can connect Earth observation and interlink it with epidemiological data, it can really help informing decisions and policymakers. Next slide, please. And here he's speaking about some concrete projects that are already in work. And one of them is in India, where they were combining waterborne disease data sets, concretely of cholera, with Earth observation, and then using this to predict outbreaks in areas using AI. And I think the important insight here is that if you are able to predict outbreaks, you can better manage the response, because you can, if you predict the outbreak, you can bring medication, resources into the areas that will be affected, and then when the outbreak happens, you can respond faster. Next example, please. Here, yes, this I think is another example. He wanted to present the thermal stress assessment, which allows you to see at a quite precise scale heat islands in cities, which is an important factor for public health decision making, also because thermal stress can have impact on health outcomes from cardiovascular to other disease. And if you are able to understand where you have heat islands in cities, the public health response can be precise and can help mitigate the impact of these heat islands. Next slide, please. Yeah, and I think here it's going also in the same direction, the impact of Earth observation on non-communicable disease. So I think the heat islands we just speak about are one factor, but then there's other factors like heat, stress. There's other factors like noise that really have a very strong link on the effect of noise on health outcomes, again, cardiovascular disease and other outcomes. And Earth observation data can help if we overlay it with health data to really understand. And then when we understand where the problem areas are, we can respond better. Next slide, please. Yes, here I think that you wanted to show a little bit of different partnerships that are happening between the European Space Agency and different organizations. So we have a innovation partnership between the Geneva Digital Health Hub, the Space and Global Health Network, and the European Space Agency, which is showing through different activities. One of them was, for example, a Space and Global Health Hackathon that we developed together. And in the Space and Global Health Hackathon, we brought different stakeholders from the health and space ecosystem together that worked on concrete solutions or propositions to address some of the challenges we've just seen. And the interesting thing, and I think what he wanted to present here, was that some of the solutions that came out of the hackathon that went into a kind of an accelerator and have really developed into some concrete projects now. And I think one of them is also on thermal heat and heat islands in the city. And then I think they also have a collaboration with the World Meteorological Organization and so on. And then, yes, you can move to the last slide, which I think, yeah, is an interesting resource for anyone who's interested in what Earth observation can do for health and others. So I think if you go here, you can get more information on the different sectors they're working on. And yeah, I think that was the last slide.
Thank you very much, Caroline. I would like to ask our audience if there are any questions for our presenter.
I had one. How are you working with the European Space Agency except on the hackathon? Do you have any other example on the different collaboration you may have with the ESA?
Sure. So we are also all working together in the Space and Global Health Network that we are operationalizing. So the Space and Global Health Network, as I mentioned at the very beginning, came out of a UN interorganizational working group, but is now a network that is established by its own. There we bring different actors around space and health together, and there we work on different activities. So we just finalized the development of the Space and Global Health curriculum that will be made public soon. And the idea of this curriculum was also to find an agreement on, in the domain of space and global health, what should be the core components, what should be taught. So this is one of the examples we have collaborated on with ESA, but also other organizations. The next step will be to produce some MOOCs and policy briefs based on the curriculum that has been developed, that's in the work plan for the next year. And then, as I mentioned, one thing that we are both very interested in and working on making concrete are the space-based essential variables for health.
Thank you very much.
Thank you very much, Caroline. And this also illustrates how Earth observation for health can also contribute to what the school is doing, and how, what kind of collaboration can be put in place, because Frédéric Bretard, who is the director of the school, just wrote in the chat that certainly part of the Earth observation for health projects are also school compliance. So there can be very good collaboration that could take place among both entities. So thank you so much, Caroline. If there are no further questions, I think I can propose that we move to the presentation of the 3-scope project. Thank you so much.
Thank you, Anne-Claire. So yes, now we are thrilled to present the 3-scope projects. So the first one will be the EWSHR from China, that is supported by CNSA, so the Chinese Space Agency. And then we'll have 2 French projects, so ARBOCARTO, supported by the CNES, the French Space Agency, and ClimHealth, also supported by the French Space Agency. So to begin, we are very delighted to welcome Shenxin Li from the Central South University in China. We'll present the project EWSHR. So as mentioned by Anne-Claire at the very beginning of the meeting, this project is developing an online monitoring and early warning system to reduce health risks from air pollution, especially exacerbated by abnormal weather conditions. So the floor is yours.
Okay. Can you hear me?
Yes, it's working.
Okay. Okay. My PowerPoint. Share my PowerPoint.
I will share it, and you can just tell me to change the slides.
Can you see my PowerPoint?
Yes, we can.
Okay. Good afternoon, everyone. I'm Li Shenxin from Central South University. It's my great honor to introduce the EWSHR project. This project is led by the EGS group of Central South University and the Chinese Academy of Science. Our group is mainly use GIS technique to solve environment and associated human health problems. Our goal of this project is to provide services to mitigate the impact of human health risks induced by air pollution and climate change. The project is mainly deployed in mainland China and a key research and application base in Changsha, Hunan Province, which is the city of Central South University located. At present, we have officially launched the basic services and applications, while additional services and applications are undergoing trial operation and development. The background of the project is that climate change and air pollution are the most immediate environmental issue we face today. These issues all occur in the atmosphere where they interact with one another and further aggravate the impacts of individual events on human health. Here is some examples of the compound events of extreme high temperatures and the ozone pollution has increased significantly. This research shows that from the past 2 decades, the number of days of such compound events in Chinese cities has risen sharply, and the population exposure to these events has increased by a large margin, with millions of person days added each year. Another study has also found that ozone exposure combined with temperature changes is closely related to adverse health outcomes. In response to this issue, the majority of current research focuses on retrospective studies and analysis with long-term series and large scales, and there is a lack of online early warning platform and services oriented to application and management. For health risks, individuals are primarily responsible for their own health, but there is a serious shortage of public health advanced service to guide people in proactively mitigate health risks from composed events. Faced with these changes, our team has proposed a solution with a core of EWSHR project to provide government and the public with air pollution health risk avoidance services under abnormal weather conditions. For the data support, including satellite remote sensing data, ground monitoring data, numerical model data, as well as abnormal weather and pollution event datasets, health data, and other data. The choice of satellite data, we use phone-in series satellite, Himawari satellite, and other satellites such as Terra, Acro, Grossi, James. This satellite data provides us with large-scale, high-temporal, and spatial resolution observation of air pollutants such as AOD, ozone. Ground monitoring data, on the other hand, make up for accuracy of local pollutant concentration monitoring. Second is the model development. This mainly includes two parts. First, the environmental parameter revival model on satellite and ground observation data, such as the revival of new surface PM2.5 and ozone concentration. The second is the construction of health risk assessment model. Here, we built a scientific health risk assessment model, EWSHR, which can assess the health risks of the public from different diseases. Third is the service tool development and application. Based on the above data and models, we have built a complex set of service tools to realize the transformation from technical research to practical application. The core applications of these tools include the identification of abnormal weather, air pollution warning, health risk warning, and so on. These applications are oriented to different users and provide target services, which I will introduce in detail in the next part. The project delivers two official online services for monitoring and early warning of air pollution-related health risks, which are the WebGIS platform on air quality and health risks and the individual air health. Let me introduce them one by one. The GIS platform is a professional platform, mainly oriented to government departments. It has three core modules. The first is the satellite data module, which shows the results of AOD, ozone column concentrations, and so on. The second is the air pollution mapping module, which can display the air pollution distribution at the 100-meter scale in Changsha and the kilometer scale in the home China. The third is the health risk assessment module, which can show the spatial distribution of population exposure to heat wave events, ozone events, PM2.5 events, and their composed events. The IAH application is a personalized service application oriented to the general public. It has the following functions. First, it can provide real-time pollutant concentration and health exposure risk assessment results of the user's location under abnormal weather conditions. Second, it can generate real-time health risk rankings and air pollution rankings for typical scenarios such as residential areas, parks, hotels, and factories, helping the public choose safer activities places. Third, it can record and analyze the long-term exposure of users to air pollutants, providing more accuracy and personalized health services. The platform is able to provide customized services to different groups. For environmental departments and governments, this platform can provide 3 key services. First, population forecasting in extreme water. It can realize the real-time air pollution forecasting through extreme weather data and remote sensing data. Second, exposure risk monitoring and early warning, conducting in-depth analysis of air pollution health risks under abnormal weather conditions. Third, risk prevention and control decision-making support, putting forward targeted risk control opinions combined with risk analysis results. Up to now, this platform has been applied in many cities in China, such as Changsha in Hunan Province and Lianjiang in Guangdong Province. It can realize functions such as hotspots grid tracing, pollution diagnosis, concentration mapping, and real-time early warning, and provide a one-map service for air pollution prevention and control, supporting command and management evaluation for environment departments. This is the application in another city of China. In addition to government departments and the public, our EWSHR project also provides professional support for NGOs and scientists. We have built an open EGS platform, which provides a wealth of shared data sets. The platform has a data sharing center, which can provide remote sensing data, vector data, and other data sources in formats such as TIFF, SHIP, and PNG, covering research fields such as land use, atmospheric environment, and other environmental factors associated with human health. This platform has not yet been linked to the official website of the SCO. It's scheduled to be officially launched in the near term. For the public, the app has a user-friendly interface and practical functions. It can realize real-time regional risk diagnosis and push risk early warning information to mobile phone. At present, we are further exploring the integration of this application with wearable devices and trying to develop more innovation applications. Finally, let's make a brief summary and look forward to the future. The EWSHR project is a practical research project combining environmental science, remote sensing technology, computer science, and public health. We aim to solve the practical problems of air pollution health risks under the background of climate change. Up to now, the project has been put into formal operation and it continued updated. It has been applied in many cities in China and has achieved good social benefits. And its open source contribute also makes it have the potential to cross-regional and international promoting, especially for the SCO members. In the future, our team will continue to optimize the EWSHR project in the following aspects. First, expand the geographic coverage of the project from the current focus on China to more regions of the world. Second, improve the pricing and timeliness of the model, integrate more real-time monitoring data and advanced AI models. Third, enrich the personalized service functions of the platform and apps, combining with the individual health data of users to provide more accurate health risk assessment and prevention guidance. Fourth, strengthen international cooperation and communication, share our technical achievements and service experience with more countries and regions, and jointly address the global challenges of the air pollution and climate change to human health. That's all my presentation about the EWSHR project. Thank you.
Thank you very much, Henshin, for this very interesting presentation. So again, if you do have any question, please you can ask them on the chat.
I do have a question.
I can answer the questions in the chat and to now and all I can answer them later.
Would you be able to answer my question?
Oh.
So, because you said that now one of the next priorities of the project was to scale it up, so extend it to some other regional areas, but also across international borders. So I just wanted to ask you, what does it take for the project to be expanded somewhere, to be applied to other regional areas?
I think, okay, some other regional areas. I think the first we can focus on the one road, one belt regions such as Pakistan, India. In these regions, there are the air pollution are very serious problem in these countries. So I think we can expand the project to these regions.
Thank you.
There is a question in the chat from Frédéric. Do you have any feedback from some users in China mainland, for example, in Hong Kong?
Where now we have a cooperation of the school in Hong Kong. So now we have tried to use our project in Hong Kong. But before this year, we more the project more applied in the mainland China. Yes.
Thank you for the answer. And I also had one. Do you already have some metrics on who use the platform? Because you mentioned some governments, some NGOs, but do you have some metrics on what kind of user are connecting to the platform?
Okay. No.
Okay, thank you for the answer. So I don't know if there is any other question, but if you do have some, you can put them on the chat, and Shenshin will try to answer to these questions. So thank you very much for the presentation.
Okay, thank you.
So now we move to the second project, which is the ARBOCARTO project, which will be presented by Anne-Lise Tran, who is Senior Researcher Scientist at CIRAD, a French institution. So the ARBOCARTO project is a predictive mapping tool designed to help health authorities target areas at risk of Aedes mosquito proliferation for effective vector control and prevention of arbovirus disease. So the floor is yours, Anne-Lise.
Yes, thank you very much, and thank you for the introduction. So, are you doing the passing the slides? Or okay,
yeah, yes, if it's correct for you.
Yeah, thank you. So you made already the introduction. So next slide, please. So the challenge is about Aedes mosquito species. There are two species, Aedes albopictus and Aedes aegypti, which are the main vectors of different viruses, dengue, chikungunya, and Zika in tropical areas. And next there is an animation. And for these mosquito on the left, the tiger mosquito, Aedes albopictus, this species has also spread very quickly in Europe, so causing serious biting nuisance, and also it was responsible for transmission of dengue and chikungunya in different cities in France. So its characteristics are that this species is able to overwinter in temperate regions because its eggs are resistant to desiccation. So two species, these two mosquito species can breed in various breeding sites. Here on the right, very small water recipients, as you can see, small size, and these recipients can be filled by rainfall or by the humans with artificial flooding. And given this situation, there is a need in tropical and also temperate areas to develop some surveillance tools that can be used in various geographical contexts in different cities. Next slide, please. So the project was to develop a predictive mapping tool for these two species to map the mosquito population densities at a spatial scale adapted to the organization of surveillance and control actions. So it's more at local scale for a city, for example, based on different sources of data, including remote sensing data. The tool was developed at the request of the French Health Ministry. And then it was also labeled by the SCO. And then with different projects, we were able to develop this tool with different colleagues and partners to have this simple tool to run a model and to map Aedes mosquito populations. Next slide, please. So how does it work? Oh, stop. Not so quick. Sorry, yes. So the model, the ARBOCARTO, is based on the process-based mosquito population model here on the right, based on the mosquito life cycle from eggs, larvae, pupae, then adult female mosquitoes taking blood meal and then maturing their eggs and then laying their eggs, and so on and so forth. So this model, this life cycle of the mosquito is highly dependent on meteorological variables such as temperature and rainfall. So we incorporated in this process-based model all the knowledge that we have on the impact of temperature on the mortality rates or transition rate from one stage to another in the model. And then the ARBOCARTO, it's really the interface software to run this model. And as input, we need an environmental file, so a file describing for a city the different parcels, the different neighborhood, with the description of the availability of breeding sites, then the daily meteorological variables, temperature and rainfall, thank you, and as output, the tool provides geographical files with mosquito density. So the same files as in the input, the same parcels, but with the information of the prediction about the number of eggs, larvae, adult mosquitoes in the parcels. And these geographical files can be integrated into geographic information systems, can be visualized in Google Earth, for example, or also can be integrated in the information system of the French Health Ministry. Next. And remote sensing is coming to characterize the environmental file that is used as input of the model, together with other environmental information maybe coming from the field, from observation on places where there is a lot of breeding sites. And also, because it's a process-based model, it's possible to simulate different vector control or vector prevention actions. For example, if we remove breeding sites or if we use adulticide against the mosquito population, etc. Next. So to explain how satellite data can be used, the idea is that there is a link between these breeding sites, which can be artificial or natural breeding sites of small sites, and what can be seen from a satellite as the urban typology, the type of urban classes from with here you can see different pictures. So we have this complementarity between field observation and satellite data, and the combination between the two. Sorry, next. We need these correspondence tables between different, for example, land cover classes and the number of breeding sites. So that's the idea. Thank you. So the main users of ARBOCARTO today are the regional health agencies who are in charge of organizing the surveillance of the mosquito in different regions, mainly in tropical areas like Réunion Island or also Mayotte. So you can see on the right, it's a map produced with ARBOCARTO, but on the website of the Mayotte Regional Health Agency. So with the map, they also provide some recommendations about how to deal with mosquitoes. It is also used here in southern France in Occitanie, for Montpellier, for example, or Narbonne. And in some places, we did a lot of trainings during the last year in different places, not only in France, but also in Europe, in the framework of European project, and also in Brazil. If you want to know more about ARBOCARTO, there is the website and our contact. And you said I can make a demonstration of the tool. So if I can share my screen, I can show you the tool.
Yes, I stopped the sharing, so maybe you should have access.
Can you see
Perfect.
something?
Yes, it's working.
Okay, so since the tool was labeled by school, we provided different translation in English and also in Spanish and Portuguese. So for the English one, you see on the left, you have different menu. It's very simple. Initialization, simulation, the settings, the production of the environmental layer, and also the possibility to have an annual backup. For the initialization, you have to choose if you work with Aedes albopictus or Aedes aegypti. And for Aedes albopictus, if you are in a tropical area, there is no diapause. If you are in temperate area, there is a diapause, and you can enter the start of the favorable period and the end of the favorable period. And for the simulation, you have to indicate a work directory. So it's a folder on your computer where you have this environmental file and also all the meteorological data. And then the user can choose for the output, is it for one date or for a period? Can choose the frequency, can choose the format, the output format, is it shapefile or is it KML, and the output directory. So it's just to run the model. And after that, the generated files can be visualized in a geographic information system software like QGIS. So here it's an example in Narbonne. So it's a city in southern France, a quite small city, but we worked with them very recently. That's why I choose this example. So here you can see really this is Mediterranean Sea, and this is Narbonne. And so ARBOCARTO is running at that scale with some neighborhoods like this. And the predictions are made for this type of neighborhood. Okay. And the outputs, so this is the environmental file, empty. But as output of ARBOCARTO, you can have predictions. So with density classes, for example, of Aedes albopictus. So this is in March. Everything is green, no risk, no mosquitoes. And this can be later in June. And here you can see an heterogeneity of the risk between the different neighborhoods. So for the regional health agency, they can really focus on some places to do the prevention. And so this is Narbonne is quite a small city, but the tool can also be run, for example, here in Montpellier. The Montpellier area is bigger, but it's really the same idea. And then you can see these different neighborhoods with different risks, not in March, but later on during the season. And these maps can be produced every week or every month, depending on the user choices. So that's well for me. And yes, I wanted to add a slide, if I may. Last year, we recently published a book. It's open access about the use of remote sensing and spatial modeling with applications to the surveillance and control of mosquito-borne diseases. And you have different examples. ARBOCARTO is one chapter among all of this collective book, but you can also discover different applications developed by different teams here in France of the use of remote sensing and spatial modeling for mosquito-borne diseases. Thank you.
Thank you very much, Annelise, for this very interesting presentation. So again, if you do have any question, please, you can ask them on the chat. If there is not at the moment, I have one for you. So you mentioned that you are working with some Brazilian institutions, academic institutions. Do you plan on developing the solution in other geographic areas that may be of interest, for example, for these issues, or will you just stop with the regions you have already developed the solution for?
Actually, it's already developed because it's only a software, and then you can apply it everywhere. You just have to prepare the data from your own country or own city. So for the trainings, we did that. We prepare some training data set on Rio de Janeiro and in another city in Brazil, and we provided it with the training. But other data sets can be also prepared from the users, but the idea is that that the ARBOCARTO is only the tool, but the data are coming from the users, and it's already available.
Thank you for the answer. And there is another question on the chat. Will you have any project for Mexico or the American region?
Yeah, that's interesting. We have a colleague, Claudia Lavalle Guzman. She's here in Montpellier, but she's from Mexico, and she's in Mexico right now by her family, and she's very interested to develop project with Mexico. So yes, please contact us, because definitely, yes, 1% of the team is interested to develop projects with Mexico, and she already started, I think.
Can we give your email address?
Yeah.
Just can you give us your email address so that they can?
Yes,
yeah.
We have a generic address, ARBOCARTO at.
Thank you, Agnès.
And I have another question. Have you tested your model through in situ measurements?
Sorry, to what?
Did you test your model through in situ measurements? So
yes, sure.
Okay.
Yes, that was before developing the tools. We tested it. I had the so first in Montpellier, not in Montpellier, but in southern France, with colleagues from Montpellier, from Aedes Méditerranée. We developed the model, the very first model of Aedes albopictus in temperate area on Nice. It was really at the very first place where Aedes albopictus was detected in France. So we had the data from Nice and the temporal dynamic of the mosquito. It was eggs collected on the field, and we could validate this very first model in Nice, and we developed a very preliminary application. It was a QGIS package at that time. And then we had the opportunity to work with the Health Regional Agency of Réunion Island, and they had also a lot of data, in situ data, to validate the model. So we adapted the model for Aedes albopictus in temperate areas to a tropical area. And we validate again in Réunion Island and also in Mauritius, which is an island very close to Réunion. And then with the SCORE project, and we had the opportunity to develop a generic tools working not only in one place, but everywhere. So we also validate the model with different pilot sites, Montpellier, Grenoble, and Bordeaux, with different climates. And of course, as often as we can, we are very happy to compare the outputs of the model with in situ data when it's possible.
Thank you. Wonderful.
And there was one last question.
We are usually very cautious before providing a tool. We want to be sure that it's okay. All models are wrong, but we just check that they are not too wrong.
And yeah, there is just one last question. Does it also work for dengue hotspot analysis?
Yes, it's not. So the model was really developed for mosquitoes. So and validated against observation on mosquito abundances. But mosquitoes, it's not the risk of the disease. It's one one important component, but it's not the disease risk. So there is also a module of the basic reproduction rate of a disease, the R0, so the number of secondary cases that one first human infected case can generate through the mosquito population. And this was only validated using dengue data from Réunion Island during 2018 epidemics. So the model is ARBOCARTO is providing an estimate of R0 value for dengue, chikungunya, and Zika, but it's just a risk. It means that if a person infected by the virus arrive there in that place, then it may happen that you will have this number of secondary cases, but the risk of introduction is not modeled. So yeah, you have to interpret the outputs of the model with caution.
Thank you very much, Annelise, for all these valuable insights. And if you do have any question, Annelise just put the email address on the chat so you can contact them directly. So thank you, Annelise. So for the third and last project, we are very happy to welcome Vincent Herbreteau, who is health geographer at IRD, which is the French National Institute for Sustainable Development, and will present the ClimHealth project, which aims at integrating satellite-based climate and environmental data into health surveillance system. So Vincent, I will share my screen and you can present.
Good evening. Thank you for the introduction. Thank you for this opportunity to present the ClimHealth project. So the project was coordinated by Espace Dev, our research unit with IRD, Université de La Réunion, in collaboration with Institut Pasteur du Cambodge. We are not in full screen mode, if you can switch. And the objective is to monitor climate and environment through Earth observation for health surveillance, with application more in Southeast Asia, in Cambodia, where I am based, but also in Myanmar and Thailand. So we develop open source tools, and the project, which this co-project started in 2020, and is still ongoing and operational. I don't see the slides in full mode. If you can switch, sorry. So the context, as it was said before, is we have certain diseases, not all, that are influenced by environment, meteorology, and climate factors that make them sensitive to climate changes. And we call them the climate-sensitive diseases, CSDs. And where we work, it includes dengue, malaria, leptospirosis, also a bacterial disease that are monitored in tropical area. So we first developed this dashboard you have here in Thailand about to see and model the relation between some diseases like leptospirosis here and climate with rain here. It's a disease occurring during the rainy season, so we can use that to make some models. Next slide, please. So the challenge is for us how to leverage the use of spatial information to inform health surveillance. I take here this framework from the, as you may know, from the One Health, and we are here in the first step with environment, human and animal health together, and we try here to see how we can monitor this environment and climate through Earth observation, in situ measurement for meteo data, local knowledge also. The second step is to see how we can produce this information in near real time, produce indicators, with the final objective is to inform society decision makers, next please, through health information system, to bring this information in near real time in the health information system. Next please. So the solution we developed, as it was presented, I think, by Caroline first, is we have a need to develop pipelines to produce and transfer the satellite-based indicators to the end users, to inside the health information systems. So we started in 2017, soon after the launch of the Sentinel-2 satellite from the Copernicus program, with this project S2 Malaria, Sentinel-2 for malaria surveillance, also funded by CNES. We focus on the Sentinel-2 satellites because of their spatial resolution of 10 meters and also the temporal resolution. We have image every 5 days and most of all they are free. So it's perfect for this kind of surveillance. We develop different tools here. The first one is a processing chain called Sen2 chain to automate the acquisition of the satellite image, the pre-processing of this image. Second, we develop some tools like Sen2 extract to facilitate the query of this image for specific location and dates. We work on a temporal smoothing to recalculate values when we have clouds, for example, because it's optical satellites. So it's kind of smoothing, modeling. And then the fourth step is integration into health information system. Next, please. I will just give a focus for these tools and to extract that we have now operational in Cambodia in the laboratory where I am based at the Institute of Technology. So here we process all the Sentinel-2 image for Cambodia and the sites that we have for health surveillance. In this tool, anyone can come and just upload a geographic files with point or polygon. You can choose the spectral index that you are interested in, the dates, and you will get a CSV with statistical information for every day for these indices. So this is a kind of data that we need daily in a routine and that we can produce now in our system. We have a sister tool in Réunion Island also where it was first developed, CISO station. Next, please. The second phase is the implementation in early warning system. So during the ClimHealth project, we had the chance to work with a big project in Asia called ICOMOR2, coordinated by Institut Pasteur and funded by AFD. So this project was made for one part where we base this work in Myanmar, in Yangon, with the National Health Laboratory, Institut Pasteur du Cambodge, Institut Pasteur de Nouvelle-Calédonie, and IRD. And they conduct a multi-center hospital-based case control study of leptospirosis by developing diagnosis in 10 hospitals around the Yangon area with PCR, ELISA to make the diagnosis. We could include in the study 309 patients, 139 positive cases between May 2019 and September 2020. Next, please. So we started to produce satellite information, Sentinel-2, to calculate environmental indicators around the location of the patient that we can get in this study, and doing also this temporal smoothing to recalculate values for a few weeks and months before the onset of the symptoms. Then we do some statistical modeling to see if we can have indicators, environmental indicators of when and where we have case, and we could find some interesting indicators with the NDVI, vegetation, 10 days before the onset, humidity with NDWI GAO, 55 days before, and water NDWI, 70 days before. We found here what we know for leptospirosis, which is environmental bacterial disease linked with the water, with the flooding and an impact of this flood and rain about from 1 month to 2 months before the case occur. And the best model we could do was a support vector machine model. Next, please. So the last step was to develop a web application called Lepto-Yangon. We did also a segmentation of the landscape to apply the model in small areas. We use the same indices to do this segmentation, and then we run our tools to automate the download of the satellite image, the process of the indices, and we developed this tool with RShiny. Next, please. So the tool is online. You have the link on the top right. You can test it. It has been running now for more than 5 years. You can see, so in this area, you can click on any small polygons. You will see the curve. The red one is a suitable environment from low to high risk in darker red colors. We can also look at the different indices. This one is the vegetation, water, and humidity. We are here in September in this example, so it's during the rainy season. That's why it's quite blue. And you have a lot of rice fields around the cities where most of the cases are occurring. And we can also calculate retrospectively the risk and animate the map to see how the environment is changing in time and space. What is interesting also is that we have some change at very small areas and also rapid change during the rainy season when the risk is increasing. Next, please. So just to mention, this tool was presented in the World Meteorological Organization State of Climate Service for Health report ahead of COP28. And a key takeaway from this report that you can download on internet is that there is a huge potential for enhancing the benefits of climate science and climate services for health. Despite examples of success, data shows that the health sector is underutilizing available climate knowledge and tools. At the same time, climate services need to be further enhanced to fully satisfy the health sector requirements. We have still a lot to do. Next, please. So since then, we are working on other application of this integration of satellite information in health systems. We also develop pipelines to automate the acquisition of ERA5 climate information. We choose ERA5 because there is a low latency for retrieving the data to help us to build early warning systems. We are working on malaria, so with the Cayenne State and research team in Thailand, Choklo Malaria Research Unit. This work has been extended to a transborder malaria surveillance between Cayenne State and Thailand. It was asked by the Thai Ministry of Public Health. And we are also working on dengue in Cambodia with the Ministry of Health. With this tool also integrated climate information and soon early warnings up to 12 weeks. So if you need more information, we have a website, geohealthresearch.org, and a QR code here. And I will be happy to answer any question.
Thank you very much, Vincent, for this presentation and all the information you gave us. So if there is any question, just put them on the chat as usual. And I had a question regarding the role of the Institut Pasteur. How did they help you to develop the platform? What was their concrete role within the project?
So the role is not really for the platform. The role is very important because we need to calibrate the model with data, as Anneli said before, with data from the field, from surveillance. It's working on the health sector. It's quite difficult to have precise information. And we had the chance to develop the models of leptospirosis in Myanmar because we were involved in this project with access to very precise information spatially. With the location of the case, we could have the GPS location of the people. We could have a lot of information that help us to calibrate the model. So yeah, we cannot work alone. We have to work with our partners on health. At that time, it was Institut Pasteur, and we basically work with the Ministry of Health also, because what we try to do is to send them the information.
Thank you for the answer. There is a question from Frédéric regarding the CEN2 extracts. Is the service offline? Because it said that it's not running.
The address is this one. So you have to upload a file on the area where we have image. And then you choose the index, you choose the starting date as date, and it should be okay to process, but I don't use it every day. So please come back to us if you see something. But the data, the satellite image are routinely uploaded in the system.
And he also asked if you can mount a CEN2 extract server for any part of the world, or is it specifically for Cambodia?
So yes, yeah, we are. We have this server and storage in Cambodia because we have the idea is also in countries where we have a difficult access to satellite data, spatial data. So we have access and we have all the database here in Cambodia and a few areas where we have this routine calculation of spatial information, and we have in the Indian Ocean with the Reunion station. So we don't plan to process data for all the world, but the tool could be installed in by other people in other area because the code is open source.
Thank you. Is there any other questions? And you also mentioned Thailand. So do you have any contact with the space agency, for example, in Thailand? Would you like to develop some connections with GISDA? Or?
Yes, I think it would be interesting. I used to know some people at GISDA. It's a big spatial agency in Thailand doing great project. We don't have Dutch agency, so much agency in the region. So yes, I think it could be great. In Cambodia, we develop these tools within a university and collaboration with ministries. But I think it's more powerful when we have a space agency.
Thank you very much, Vincent. I think there is no other questions. So I think our webinar is now coming to an end. And Claire, I'll give you the floor.
Thank you very much, Alexia. Yes, indeed. I think it was really insightful. Our 4 presentations were really, really good. And it was actually the first time that we were really investigating in this topic regarding health and space. So thank you very much for being with us today. And I think now we can close. If you have any questions, please feel free to contact our presenters and also the school secretariat. Thank you very much and have a lovely end of the day. Bye.
Thank you. Goodbye.